who remembers his own education, remembers teacher, not the method and technique. And the teacher is the heart of the education system. And so is our beloved Professor Dr. Achla Batra, who has been a dedicated PG, postgraduate and undergraduate teacher for more than 35 years at Bardhaman Medical College and Safdarjung Hospital, New Delhi. Presently, she is the president of AOGD 21 to 23 and has been the president NARCHI 2018 to 20. It's very difficult to enumerate her credentials. Apart from being editor and holding multiple high positions in AOGD, NARCHI and other societies, she has been actively involved in conducting research projects for LSTM, ICMR and Indo-US project. She is the author of Workbook of Obstetrics and has contributed several chapters in books, many original research papers in national and international journal, and a major role in IMA guidelines. I welcome you, madam, once again and need your blessing and few pearls of wisdom. Professor Dr. Achla Batra, please.
Thank you, Dr. Rajkumari. Thank you for the kind words. And Dr. Sharda Jain is so gracious that while she is there, she has called me as a chief guest, which is, something it should not be done with her being there.
Doctor, आपकी chair इतनी बड़ी है. Doctor, आपकी chair इतनी बड़ी है.
मैडम मैं स्टूडेंट तो आप ही की हो ना.
कोई बात नहीं. Chair बड़ी है.
So today's topic is very pertinent. Like Dr. Raj said that in 2012 the POCSO Act came, and to date I know of many doctors, most doctors, they don't know much about it. They're not taught about it in their undergraduate curriculum. They're not taught about it in their postgraduate curriculum. And so nobody knows much about it. They all know that yes, a sexual assault victim how it should be examined. But beyond that, there's much more to POCSO Act. So I think the topic is very, very relevant. And we have, authority, Dr. Sonia, who is, I think, Honorary Secretary of National Medicolegal to talk about it. And I can see many, many other people who are experts on it. And I'm thankful to Dr. Sharda Jain ma'am, DGF Medicolegal Cell, IAP and IME for having called me for this very informative webinar. Thank you very much.
Malti, can I have the CV of Dr. Sharda Jain?
मैडम मुझको आप वैसे हुक्म दो तो मैं आप बोलना शुरू करूं.
I feel very proud and privileged to introduce our chief guest, Dr. Sharda Jain ma'am. Though she doesn't need any introduction, a very well-known, renowned, multifaceted person, empowering with the woman empowerment is her main mission with holistic and spiritual approach. A great academician and clinician par excellence. Numerous life achievement awards, which are difficult to be enumerated. And as to me, whenever I think about her, I want to narrate on this auspicious Buddha Purnima day, Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Par Brahma, Tamse Mi Guru Dev. She's not just a mentor to me, but almost many of us present here. And the guiding force behind this webinar of MMM, that is the Master Class of Medical Fraternity on medical legal issues. It is her vision, passion and determination that she, along with Dr. Geetendra Sharma, advocate, and Dr. Hitesh Bhatt and Dr. Arvind Narayan, she started this PG certified diploma course since 15 June 2020. A course for 6 months for not more than 15 doctors at a time, similar to the Symbiosis Pune. And now the second batch is already going on. It is open for everyone, any doctor, whether a MBBS or postgraduate or any practicing doctor of any private or government sector. And whoever is interested can contact me. And the course is to upgrade you, to update you, to protect and prevent the litigations. And Dr. Sharda Jain, she is the savior of many doctors, especially the gynecologists, being a legal expert in DMC for more than 13 years, and now she is in the ethical committee member of MCI, now known as the NMC. We are fortunate and we are honored, ma'am, to have you here, and we need some remarks from you. Dr. Sharda, ma'am, please.
Thanks, Dr. Raj. I think welcome to everybody, the gynecologists, the pediatricians, the legal luminaries, the medical legal luminaries who are present in this particular seminar. In fact, Dr. Sonia, we can say that this is a long-awaited webinar. We have been thinking about it for the last 6 months, but somehow you were in USA and things like that, it did not materialize. And we didn't want to know, because you people are used to having a presentation at late 8 o'clock in the night. So we said, no, we will have at a reasonable time. So I think with the cooperation of my great friend, Dr. Goyal, who is the chief, medical legal chief as far as your body is concerned, pediatrician's body, that, he has managed this particular topic. I can definitely say that after PCP and DGF Act, that also harassed doctor left and right.
Please.
And as the POCSO is the next in line. POCSO in next in line because we do not know anything about this particular thing. Because what we find ki majority of the gynecologists I know, the child is defined less than 18. But if the child, that particular child comes, even if the child is 15 years, we will write down on a case record the child is 18 plus and want to cut short all the hassles related to this particular patient's registering examination, reporting thing, everything just is shelved. So I think, the time is not far away. Underreporting is to the tune of 100%. Only 1 or 2 people are reporting. So I think, they need to know this particular thing time and again, except in few institutions, things are done properly, but otherwise it is not done. And we all know about it. The sexual assault, whatever the figures the government is telling, it is a gross underreport.
Absolutely.
Leave a sexual assault are both boys and girls. Both boys and girls. Sexual harassment is left and right. Sexual harassment के लिए तो आप मानेंगे नहीं, हमारे जैसे लोग सफेद बाल हैं उनको भी नहीं छोड़ेंगे ये. So you can see, the sickness in our own this thing. But what I wish to tell you is that with Sonia, you as an expert around, and so many medical legal luminaries here, that we will definitely be guided and we will leave our comments for the discussion part of it. So over to you, Dr. Goyal, to introduce Madam Sonia.
Ma'am, let me introduce Dr. Goyal, please.
Okay, that's right. Sorry.
Can I have the slide, please? Dr. Geetendra is in the train, so he's like, whether he'll be able to join or not, he was the another chief.
Doesn't matter. He's a guru for all of us.
So it's my pride privilege to introduce our chief guest of the session, Dr. V.K. Goyal. For today's webinar, it is all due to his support and effort. He is a very senior pediatrician, HOD and director of Panchil Hospital, Yamuna, Bihar, East Delhi. He has been a past president IAP, a very kind, humble and easily approachable person. He is also doing regularly organizing medical legal webinar, and presently he is the chairperson of Central IAP Medical Legal Group. He is a great academician and involved in clinical trials, multiple papers in national and international journals. Once again, I welcome you, sir, and now I request you to introduce the star speaker of the today, Dr. Sonia. Please, sir, and also speak a few words.
Thank you, ma'am. Thank you for the kind introduction. And I also thank Dr. Sharda, ma'am, for inviting me here as a person. This is definitely, as everybody said, this act, we all clinicians are not aware. We don't know what is this act. Nobody knows it. And of course, sometimes we report it, sometimes we don't report it. And if we don't report it, we are in the queue. We are being held by the legal authorities. Why you have not reported? This is the main drawback of this law. If I am not reporting the case to the police, I will be held up and I am answerable to it. Leave aside the victim. I am first culprit of the case. This is very important. For this, we have got a very senior pediatrician with us. She is the secretary with me in the medical legal cell of Central IAP. Dr. Sonia got the fellowship this year of IAP.
Malti, can we have the CV, please?
I am introducing Dr. Sonia, and she is the National Awardee of Community Service by Central IAP in 2019 at Indore, and she was awarded as Thamareppa Award in 2017. And she is maintaining a kindergarten and adolescent clinic center in Bangalore. And right now, I said she is the honorary secretary of the medical legal cell of Central IAP. She was the organizing secretary of adolescent in 2019, vice president IAP Bangalore 2017, and convener adolescent care in office practice zonal organization member of Pedicon 2009 and 2017. Member IAP National Task Force for Obesity, National Trainer for in Adolescent Care, Vaccinology, Diarrhea, and Ask Me More, etc. Contributor in Colored Athletes of Central IAP. Now I request Dr. Sonia to start her presentation.
Thank you so much, sir, for this kind introduction. Though I am a very small person in the sea of experts here, especially when Dr. Sharda ma'am is in front of me. Madam, please pardon me if I go wrong somewhere, ma'am, please. All the experts and all the seniors here, if I say anything wrong, please point out. So I will, shall I start sharing my PPT?
Yes, ma'am.
कर दिया मैंने. ठीक है मैम, आ रहा है?
Yes.
Okay. So good evening, everyone. I am very glad to be here with spectra of doctors who are listening to me today, and I hope I am able to make this very clear act in some ways, but there are many challenges also. To this POCSO thing, why the government thought of doing some amendments to the earlier laws and then came up with this POCSO Act of 2012. There was a lot of child abuse here. Let me give you some figures. That is, see, what I'm talking today is not the present figures. These are the figures which led the government to go for this POCSO in 2012. So at that time, 1 in 5 women and 1 in 13 men reported having been sexually abused as a child aged 0 to 17 years. That means before the age of 17 years, they were already sexually abused. 120 million girls and young women under 20 have suffered some form of forced sexual contact. Why? I'm not going into the depth of it, because everybody knows that a lot of cultural invasion, media onslaught, information age, digital gadgets, all these things are responsible for increase in child abuse. But one important point which I want to bring to everybody's concern is that it is not only girls, but boys are equally abused in today's world. What is pornography? Pornography is another rampant thing in our society, though it is hidden quite a lot. So in 2019, technology firms, they found and they tagged more than 45 million photos and videos as child sexual abuse. This was an investigation by the New York Times. That number more than doubled in 1 year. Now, what is pornography? I just want to define it because it is very important. Most of us don't know exactly the minor details what is pornography. It is interest in nudity. Erotic pictures are part of normal sexual curiosity. So pornography is given rise to because of the interest. Pardon? Anybody wants to say something? Okay. So
Yourself. Everybody mute yourself, please.
All right. And then there was a lot of bombarding and invasion by the media. That is, in our films, in our movies, we can see there's so much of romantic scene. There's not much of censorship. This all gives rise to pornography interest. There are unscientific magazines and dirty books, which we all know about. But important thing is pornography is not dealing in truth. It is a business. It is not giving the curious teenagers and the curious young adults who go to find answers in pornography are not getting answers. They're getting false images. They're getting false education. They distort the image of woman as a sex toy. They reduce the sexual development, which actually the sexuality which has to happen during the teenage. Obsession is definitely abnormal for pornography, and effective legal action, which is important, is lacking. And especially now, let me mention here that in COVID-19 era, since most of us are homebound, there is definitely increased business of pornography. So please note how important is now POCSO now for us also in this era. Now, this is just a minor thing, but it is not so minor because all these issues of child sexual abuse gives rise to mental health problems. And these mental health problems are hidden in our society. 1 in 6 people are aged 10 to 19 years who have mental health problems. Mental health issues account for 16% of the total mental health disease and injury in people aged 10 to 19 years. 50% of these problems are started by the age of 14 years, but mostly we don't come to know about it. World over, depression is one of the leading cause of illness and disability for adolescents. Suicide is the third leading cause of death in 15 to 19 years old. All these points, why I am mentioning, because child sexual abuse leads to a lot of mental health issues. So, as a consequence of all these issues, we are very thankful to the government that they brought out POCSO Act. Some shocking facts which I wanted to show you here are that the increase in incidence of juvenile crime tripled in 2 years, that is from 2012 to 2014. More than 50% of all the crimes against children are related to sexual offense, and the number of juveniles who are in conflict with the law has been increasing. Because of that, we are seeing a lot of shoppers, kids getting raped, all these news which led to our POCSO Act becoming more and more important each day. So now let me come to the actual thing which we are all waiting for. What is POCSO Act?
Dr. we can see.
All right, I will make it full. Yes, ma'am. Is it clear now, ma'am?
Yes, yes.
All right. So let me start once again from where I left. So let me tell you what is POCSO Act 2012. It stands for Protection of Children from Sexual Offences Act 2012, which received the President's assent on June 19, 2012, and it was notified in the Gazette of India on next day, June 20th, in the same year. What is the definition? Any sexual act, consensual or non-consensual, with child below 18 years is sexual offense. This is the gist of this act. Now, I want to make you understand this POCSO Act in a practical way. So what I have done is I have taken a case from my clinic where I am making you understand what we go through in the clinic and how we, think about the thing. And then we will talk about the further details about the POCSO Act. So I got in my clinic an 11-year-old girl who was called Vibha. She saw me at my clinic few days back with pain abdomen since 3 to 4 days. She has been my regular patient since early childhood. So I took the history and it was very easy to take heads history, which we do in adolescents. It's an interviewing technique called heads, which we take with adolescents to know about the details, minute details about their mental as well as physical problems. So she told me she belongs to a middle class family. Father works in a factory, mother is a housewife, and younger sister is 7 years old. She studies in school. She's an average student. She is not eating well recently. That's what she feels. She says that I don't feel like eating. There is no history of TV watching, and right now she's not even playing much. She doesn't feel like playing much recently. Drugs, she has no knowledge. On probing about physical intimacy, etc., as we usually talk to any teenager, the teen started crying, and she revealed that her uncle had done some wrong things to her when mother went to the market. History of menarche is what we always take, but in her case, there was no menarche. The adolescent is lately depressed, as she said, and for the last few days, she is not happy. Otherwise, when in my clinic I used to see her, she was a very bubbly and happy child, so I could make out that there was some mental change in her. Now, on examination, as she entered my clinic, I could see that she is generally pale and she is sad. She has scratches around her mouth and face, and on further examination, there were a lot of bruises and lacerations in her lower abdomen and chest. There was no frank bleeding. Cuts and nail marks were there on her thighs. Mental examination, of course, as I could very well make it, that she was in a very confused state. She was in a depressed state. She didn't know what to say and how to reveal everything to me. Now, as pediatricians or as doctors, if I get this case, I will have three possibilities to do with this. One is, I either refer this case, hush off, ignoring the facts, either I send her off to a surgeon or to a government hospital or to some other consultant and get rid, right? So this is the first possibility. The second possibility is, I will just give her medical treatment and ignore the facts. Okay, done with me. It's fine. Third possibility now is, I follow the guidelines of Ministry of Health and Family Welfare and POCSO Act. So what do? First, I need to know the guidelines of Ministry of Health and Family Welfare, and then only I can take a decision. So let me first tell you what are the guidelines. The guidelines says that this case is a medico-legal emergency. Non-reporting is a punishable offence under POCSO Act 2012. Not providing first aid medical treatments is a medical offence under Criminal Amendment Law Act of 2013. Punishment can be anything from 6 months to a year with or without fine. So please note it down. This is very important guidelines from the Ministry of Health and Family Welfare. Next, I come to the POCSO Act, because I mentioned that now we have to take a decision by the guidelines of MOHFW and POCSO Act. So now what is POCSO Act? Now I will go into the details of POCSO Act. So POCSO, as I told you, it stands for protection of children against sexual offence. I will tell you the definition which is written by the Government of India under this. It is an act to protect children from offences of sexual assault, sexual abuse, pornography. It is an act to provide for provision of special courts for trial of such offences. It provides that the special court proceedings should be recorded in camera and the trial should take place in the presence of parents or any other person in whom the child has trust or confidence, and the matters thereof which are incidental to this act. This is the exact definition, the exact words how POCSO is given. This is in the Gazette of India, written like this. Now, let me explain to you what are the main features of POCSO to understand it better. First thing, it is a gender-neutral act. That means the punishment, the treatment, everything will be given equal for the boy as well as for the girl. Any victim who is below 18 years of age is coming under this. Act ensures child-friendly process to prevent re-victimization. This is a very new feature and the most welcome feature of this POCSO Act. Police is designated the responsible protector. I will go into details of that later. Police has to make all arrangements for legal procedures and medical treatments. Compensation is to be granted within 30 days, even if the accused has not been convicted. Important point, but how far it is, done, implemented, we don't know. So that remains to be seen. Minimum punishment is prescribed and can be up till life imprisonment depending upon gravity of the crime. What are the other features? Reporting to Special Juvenile Police Unit or local police is mandatory for any person. Remember, for any person, please note it, whether medical or non-medical. That means, in case of non-reporting or false reporting, the punishment is 6 months to 1 year with fine. Punishment for abetment, supporting, encouraging the act is equal to the offense being done in person. So you see, here the accomplice is equally liable to the same punishment. Please remember, this is very important for us as well as for the non-medicals. So non-medicals are equally responsible under POCSO Act. The onus lies on accused to prove himself not guilty, and there is zero tolerance to offenders. So this is another change which has been given. This is another amendment that instead of the victim proving the crime, the victim doesn't have to prove the crime, but the onus is on the criminal or the perpetrator who has to prove that he is not guilty. This is also an important victim-friendly change that has happened in POCSO. Now, what does it mean for us? Let us come to our role here. That was in special. All these features I have described is for everyone. Now, let us see what it means for us doctors. We do not need police requisition for managing this case. So, if a case of sexual abuse lands in our clinic or in our hospital or in any medical institution, we do not need to wait for the police or for filling any form to start the management. It is a medico-legal emergency. Any clinical establishment, whether government or private, they cannot refuse to manage the victim of sexual assault. All the first aid, medical expenses have to be provided free. The registered medical practitioner rendering the medical care, his duty doesn't end here by providing first aid, but he should also collect evidence after a thorough medical examination. He should treat the physical and genital injury. He should conduct age assessment of the victim if required, offer prophylaxis for sexually transmitted diseases including HIV. He should discuss emergency contraceptives with the pubertal child and her parents. And she should also do baseline evaluation for mental health issues, monthly follow-up of at least 6 months to look for development of psychiatric disorders. So that means help is required later on also. He or she needs to do family counseling also. He also needs, the doctor, that means, has to assist the court in interviewing the child and testifying in the court. So you can imagine the role of a doctor once you get a sexual abuse case. These are all the things which we all have to do, we must do, and we cannot escape it. Now, what is the significance of POCSO? As I've already said a few things, that it is very victim-friendly, right? I have pointed out that earlier also. And there should be no delay or denial of examination. That is the most important thing about POCSO. So if a patient comes to us, immediately we have to do the evidence collection, the history taking, examination, everything has to be done by the doctor who sees the case first. So it cannot be delayed. Crucial evidence of sexual offense should not be lost. This is again a very significant factor of POCSO. Victim can be saved from succumbing to his or her injuries. You see earlier what used to happen. The victim used to keep waiting, and some people will avoid, some people will just let them, die because of lack of police coverage and all those things. There were a lot of problems happening. But now, since it's a medico-legal emergency, so we have to save the victim. That is our first role under POCSO Act. Now, let's now come back. Now, I have given you a general profile, a general picture of the guidelines under Health and Family Welfare Department, and I have also told you about POCSO. So now let's get back to our case, Vibha, right? So now Vibha's case, what will I have to do? I think all of you understand now what we have to do. The third option, if you remember, the third option was that we have to act as per the guidelines of family and family health and welfare guidelines, and also keep in mind POCSO. So what we have to do is firstly report to Special Juvenile Police Unit or the local police. That means we have to dial 1098 for assistance, and if any queries are there, so there is a child welfare committee. Suppose they don't want to go for police and some problems are there, they're trying to do some discussion, Vibha is not ready to do certain things, then you can take help of child welfare committee with the dial number as 1098 for assistance, but reporting to the police is mandatory. Then after that, the next step is medical legal. So when you start with the patient, you have to take the informed consents and you have to tell the patient what all has to be done and then carefully do it depending on the consent. Third, counseling of the family is very important in this case also, because Vibha knows about the thing, family doesn't know, so we have to tell them what are the rights of what are their rights in the court, what can they do, how can they help the girl, all that has to be done. If the doctor doesn't want to do it or is finding it difficult, you can take help from the helpline, which is Child Welfare Committee 1098. So finally, I come to this and I want to repeat it again and again. This is for one case, Vibha's case, but we come across these cases every day. So non-reporting is a punishable offense under POCSO Act 2012. Remember, not providing first aid medical treatment is a medical offense under Act 2013. Please remember this. I am telling this third time. Punishment can be anything from 6 months to a year with or without fine. And it is not only that we doctors are only liable for this, even a non-medico, if he knows about the sexual act and doesn't report, then he is also liable to the same punishment. So let's look out. Now I want to come to the big picture. You see, what I have described is a small picture that is in my clinic. And it is just me, and a decision has to be taken, and all that can be done by me. It's fine. But there is something which we have to see. There are hospitals. In hospital, who is responsible? So in institutions, who is responsible? This is the big picture of POCSO. So I'm coming to that. So I am now going to talk to you about how the hospitals have to deal with a case when they get a case of sexual abuse in their emergency. So what they have to do is, the hospitals, they need to follow a certain standard operating procedure. I will be going in details for that later. They should have trained a team of doctors to deal with this medical legal emergency. They should have specified area for conduction of examination and collection of forensic evidence. They should keep a safety kit and other investigatory tools 24/7 in their hospitals. I will elaborate each step gradually, because I know there are a lot of people here who are working in big hospitals, corporate hospitals, private nursing homes, and also in government institutions. So for all of them, this goes very well. Now, first and foremost, who is authorized to see and to take care of this patient once it comes? So when we report to the police then can authorize any registered medical. Suppose the patient comes to the police, not to the doctor. Then the police has the responsibility that they can tell any RMP in a government hospital or in a private hospital, or if any RMP is not available, then they can even go to a clinic doctor and tell them to do the procedure. So police can take this decision. And who can do the medical legal examination? I think that you will understand that only female doctors can examine the girl victim as per POCSO Act 2012, Section 27(2). But in special situations, when female doctor is not available, then with consent and in the presence of a female guardian, a male doctor can examine as per the guidelines of Ministry of Health and Family Welfare, and this amendment was done in 2014. So that confusion about the male doctor is gone. Now, what is the comprehensive healthcare response that a hospital or a clinic or anybody has to give? This is just a flow chart which I am showing, where we have to just go by the rule. So first and foremost, let me just put so first is mandatory reporting, as I have described. Second is informed consent has to be taken. I will be going in details of each of them so that we are clear what we mean by all these things. Now, informed consent taken, go for first aid, then take a nice history, go for good examination. We need to be trained for that. Evidence collection has to do. And then in the meantime, while you are giving the treatment, then at the same time, you have to tell your assistants to seal and dry the pack. That means there is evidence what you have collected. They have to be packed and sealed, and documentation has to be completed. And then once the SJPU or the police is here in your clinic, you have to hand it over to them. In the meantime, once the treatment is over, then discharge and referral activity has to be done. This is according to the guidelines and protocol for medical legal care of survivor or victim of sexual offense. This was again done in 2014. Now, after POCSO Act, I must inform all my colleagues, because, I was always afraid of police, police thamko tang karegi and all, those kinds of things. Yes, the police who is not aware of this POCSO Act, they can actually still trouble us. But I think POCSO Act, if they know and if they are told, they will be very helpful to us, because police is responsible for the rest of the procedure. So once I see a patient in my clinic or in a hospital and I inform the police and I know that my phone call has gone to the police, it will be recorded, then I don't have to worry much. I just have to go by the protocol which I just told in my previous slide. In the meantime, police is responsible for the rest of the procedures. They will be helpful in referring the child to the child welfare, where the child will stay, what is going to be the next step for the child. They will protect us from the consequences. So if the police has arrived and suppose the child dies in front of us or in the hospital, then they will be very helpful. They know what has happened. They know that we helped them. So in these circumstances, please beware that police is very helpful. Their presence is required, and even a phone call if you have done and informed them, that is also very helpful for you in such situations. So these are the things which are usually, I won't go into details, these are the things which police usually does, and so that is up to them to start the things. Now let me come into the details of each of them, because it is very pertinent to know what exactly I mean by informed consent. You see, when a child of sexual abuse comes to our medical institute or anywhere, it is very important to maintain documents. We have been telling in our medical legal, all our CMEs and workshops, how to maintain documentation, how to document the consents also, how to document the all the talks what you do. So here it is very important that I tell you very in each step how to take an informed consent or refusal. It can be anything. The child may refuse the examination. The child may refuse to tell you anything. So how to document it? So what is required? So informed consent, first of all, what is it required for? We need to take consent for medical examination. We need to take consent for treatment. But if it is life-threatening condition, then consent is not required as per section 92 of IPC. Now, we need consent for forensic examination and sample collection. We need consent for police intimation also. That means when a child or a parent enters in my clinic and they are telling me history, I need to tell them that yes, I am going to inform the police. Yeah, they may say no, doctor, mat karo inform, hame nahi karna hai, hame police ke chakkar mein nahi padna hai. They will say all these things. But please remember, it is mandatory and you just need to inform the patient. So don't think, agar patient tumko janta hai, patient is very well known to you, they have been coming to you for the last 15 years to your clinic, nahi wo request kar rahe hain, please don't go to the police. Please do not get emotional. This is one point I want to repeat again. Please do not get emotional. It is important and it is mandatory for you to inform the police, even if the patient says, requests or हाथ जोड़ता है to you कि नहीं बताओ पुलिस को. You have to just inform them that I am telling the police it is mandatory and it is my duty. That's it. Okay, so this is important. Next, we come to documentation of consent form. Now, when you have the consent, when the child or the parents or the guardian, whoever is there at that time, they have consented, then, or even refusal. So I should write here consent and refusal form. So both of them, they need to be signed by 3 people, survivor, witness, and the examining doctor. All right, so 3 signatures, 2 identification marks, or and left thumb impression. Yeah, if it is a uneducated patient. If the patient is below, or if the victim is below 12 years, consent is given by parent or any trustworthy guardian present. Now, there are a lot of controversies to it, that sometimes guardian is not there, sometimes only one person just brings the child and all that. We will discuss that later, but this is what is important right now. Now, let's see how to document history. So we have finished with the consent or refusal, right? We have documented it. Now we come to the history of the victim. First of all, very important, you have to note down the date, the time and location of the incidents. Okay? And also the date and time and where you are recording the history. I have forgotten to write it here, but that is also important. Then, who is narrating? Is it the survivor who is narrating, or is it the informant? And informant, who is it? Is it the parent? Is it some known to? Is it some relative? Please write it specifically who it is, what has been informed by that person to you. Very important. In survivor's own words, the history has to be. So when you're listening to the victim might say that dirty uncle, he did that to me. He is a very bad uncle. He used to give me chocolates. Oh, this is very important. When the victim says dirty uncle, please write it as it is, dirty uncle. Please don't try to change the words. Even exclamations, that are very important. Or they might, a small child might say, yeah, the uncle was very nice. He gave me chocolates. Then he just told me to come to the bathroom or somewhere with me, like that. So please record each and every word as told by the survivor or the victim. Even exclamations are important. These will be very important in the court of law. Then relevant medical and surgical history, as we usually ask, that has to be taken. Menstrual history is of course very important in female victims. Length, duration, last menstrual period, whether the survivor was menstruating at the time of incidence, that also has to be recorded as it is important. Then vaccination history, that has to be taken especially for tetanus and hepatitis B. Why? Because these are the vaccinations which we can actually give at that time as an emergency, and we can protect the victim immediately. That's why these 2 are very important. Rest may or may not be available, it's okay. Sexual violence history. Again, now this I'm going to take a little time to explain to you. When you take a sexual violence history, sometimes as doctors, as human beings, we feel disgusted and we feel, our own feelings are different. But I would suggest that when you are taking sexual violence history, please note, don't be judgmental. Your facial expressions should be that of empathy and not sympathy and not hatred. You should be non-judgmental and empathetic. And please record, as I earlier said, please record words like negative, not so sure, and any other word, any other cursing type of words, any other good words about the criminal, anything what they say, even the smallest minor of the points, they become important in the court of law. So this is about documentation of history, which becomes very important. I think that everybody can take. All of us are intelligent enough to do this. Then comes the examination. Now, what are the examination points? So first, general examination. As the victim enters our chamber, we can see the general appearance. We can see how is the victim oriented. Sometimes they come after taking bath and all. So, or they may have sat down somewhere. They may have had some time to themselves. So their mental state, how was the mental state when they entered? whether they are conscious, not conscious, they are drowsy, or what is the state of the CNS, central nervous system. Then what is the physical state? Very important. See, nobody will be able to see that same physical state once we have collected the evidence. So it is important to describe whether the patient came with torn clothes or whether the patient came with fresh clothes, clothing status, whether it was changed. Any other incidental observation, whether the patient came with some, hathiyar or weapon, or was there anything else, or how was the patient, who brought, all these things have to be described. They are very helpful for the case. Then we go for the special examination. Of course, systemic examination you will do, that is obvious, but special examination here means that we have to see that area where, the local area, because it's a sexual act. So we have to note down each and every scratch, the bruises, the injuries, everything has to be recorded, the number of scratches, the number of bruises, the depth, the tears, and all that has to be done. Thorough examination of genital organs, external as well as internal. Now again, in this is a very special thing, which we have to again take another lecture on this. How to do the internal, whether to do or not to do, all that has to be given as a training to all the doctors before doing this examination. So we need to be trained for this special examination. Then last comes evidence collection. So while we are doing all the examination, evidence collection, that is, if we are examining within the 96 hours of the incidence, right? Then in that case, we might get all the clothing, the swabs, and all that, the real evidence we will be able to get. That is the semen samples or any hair samples or anything, or nail samples, everything we can get, and we have to preserve it, and it should be kept in a dried and kept in the fridge till the police arrives to collect the evidence. Then all hospitals should have the safe kit, which is in the safe kit means sexual assault forensic evidence kit. I will be describing it later. It is a very nice kit created by some of our NGOs. They are available in the market, and I will be describing what all is there in that. And I think all hospitals, all institutions should have this safe kit. So let me tell you about the safe kit, that is sexual assault forensic evidence kit. Now it contains what all it contains. So it's a comprehensive thing, so that you don't have to worry about anything कि ये रखा नहीं है, वो रखा नहीं है. मतलब कि जैसे आप इमरजेंसी सिचुएशन में घबरा जाते हो ना कि ये भी चाहिए था, वो भी चाहिए था, ये नहीं मिल रहा, वो नहीं मिल रहा. तो इसलिए उसके लिए सेफ किट बनाया गया है. So in the safe kit, what all is there? See, there are forms of documentation, large sheet of paper to undress. You know why? Because when the patient is undressing within 96 hours of the incidents, there may be some hair which may fall of the criminal. There may be some other, small things which are left in the clothes of the victim. So all there will be evidence, right? So paper bags for clothing collection, catchment paper, then sterile cotton swabs and guards, comb and nail cutter, wooden sticks for fingernail scraping. See how considerate, everything is available there, Small scissors, urine sample container, tubes, vials for blood samples with or without EDTA. Then we have, so this was the photo of that safe kit which I am showing. Then syringes, needles are there, distilled water, disposable gloves, glass slides, envelopes, labels. So all this is for the lab evidence. Then there's sealing wax is also there, because when you hand over the all the evidence to the police, please beware. Don't hand over anything which is not sealed, because obviously they can also manipulate the evidence. So sealing wax is also provided there. Then the clean clothing, when you take off the, when you tell the victim to remove the old clothing, which is an evidence, then you have to give them clean clothing. So that is also available in this kit. Then there are other items like wood lamps, good torch, vaginal spectrum. These are all, lab things and examination things. Then drying rack is there, patient's gown is there, post-it notes are there to collect the trace evidence. For example, if there is a fingerprint or something, you can, take the evidence. Or if there is, just a minute. Or if there is any, some hair, small hair and all you want to collect, that also you can collect with post-it notes. There is a camera in this, but I must say a few words about this. Now, the camera cannot be used just like that. You have to take consent from the victim and the parents before taking any photographs. They are not allowed, but if you feel that they may be used as evidence, and if they are consenting to taking photographs, then yes, it will be useful. Then there is a microscope, colposcope, toluidine blue dye. These all of you know. Even pregnancy test kit is also there. Surgilube is there, and there are some minimum medications available in that. So that is about the safe kit. That safe kit is available, and you can keep it in your this thing and be free. Now let us come to the treatment protocol. Now. Treatment protocol, first aid, everybody knows. So we have to treat the injury, we have to treat the sexually transmitted infections, we have to give them that bolus dose. Emergency contraception has to be given if it is required at that time. Then vaccinations, especially as I told, that tetanus and hepatitis B have to be given as on an emergency basis. Psychotherapy and counseling is an important part of this. And in case of complications, we need a team of gynecologists, surgeons, pathologists, psychiatrists, and others. They are important and they need to be contacted. Now, once the first aid is done and all, then of course we may need some investigations. For example, ultrasound, X-ray. We may need some age confirmation. For example, some victims, they don't know their age, or maybe they are so confused they can't tell the age. So then we have to confirm the age. Advanced medical and surgical care is also required sometimes. And then during discharge, you have to assess the psychosocial well-being and you have to counsel them. Suicide ideation has to be pinpointed and we have to refer the psychiatrists, because most of the victims, especially girls, they are into the suicide ideation. So please beware that you have to refer them to psychiatrists. Help the family to feel safe, because families really don't realize in our country anyway, whenever the victim is, a girl, the family feels that their whole honor, the family honor is gone, nothing is left. So please, this is very important part of our treatment. Family has to be told their rights. The family has to be told that the victim is your daughter. Criminal is somebody else. Your daughter is not the criminal, or your son is not the criminal. So please feel strong that you have the case on your side. The government is on your side. You have to inform them. You have to inform them about the child welfare committee. You have to inform them about the support person which the police will arrange, the special prosecutors, and their legal rights. Very important. Most of the parents I've seen, they do not have any idea what they can do for their close relative, or for their daughter, or for their son when they undergo this kind of sexual abuse. Then the last part is, so this is the parallelly going part. That is, documentation is already done, and now you have written everything. But what is important is that writing should be immediate. Now it's not like this that okay, treatment ho gaya, documentation main kal kar lunga. You can't do that. Documentation has to be immediate. You have to collect all the evidence immediately. You have to seal them, pack them immediately, and keep them ready. Suppose the police is not able to come at that time, then please keep it in the fridge till the police is there. Okay, then how is the handing over? Now that is also very important. Please don't think that you have done the evidence collection, you have done everything, now your job is over. No, handing over is very important. Now handing over, what happens? Suppose you just hand over to the police thinking that police ki usne uniform pehni hui hai, उसने एक आपको दिखा दिया वो आइडेंटिटी कार्ड, आपने दे दिया उसको, सैंपल हो गया. No, this is not the way. This is important evidence. What you have to do is you have to take a signature and on the sealed envelope. So first of all, you have to seal all your evidence, first and foremost. Secondly, you have to take the signature of the police officer who is there, his designation, his phone number, everything, date and time has to be put on that. Take a signature on a separate form. Blood samples ko bhi aise hi, just the same way you have to hand over to the police. Please make yourself safe. Please do not just be in a hurry to do these things. You have to, police sometimes they don't want to sign and all. They don't want to take responsibilities. Please make yourself safe, get it signed, write the date, write the signature, write your name that I have given. A good user handbook for POCSO Act, which I think everybody can go and read it. It's very nice, ncpcr.gov.in. You can just go to that website and read it. It has. So this was all about the details of POCSO, and as Dr. Sharda ma'am has already told that yes, we are facing a lot of challenges, and still most of the doctors, they will avoid to report the cases. Not only doctors, but I think non-medicos also, they avoid to report the cases, and I think she's right. So why? Because there are still a lot of challenges and controversies of POCSO Act. I will just go through a few of them so that, I know a lot of questions are happening in everybody's mind regarding various things, because you have all gone through in your OPDs, you've all gone through problems in your emergencies. So let me just go through some of the things which are remaining as challenges of POCSO Act, and I hope government is going to take care of all the things gradually. For example, consent. Now, if the child or adolescent refuses to undergo medical examination, but the family member or the investigating officer is insisting for the medical examination, the POCSO Act is silent and does not give clear directions. What to do? The doctor is in a soup. What to do? So there is an urgent need to clarify the issue of consent in such cases. And however, it would be prudent to take informed consent from parent when the survivor is a child below 12 years, and consent from both the parents and the victim if the survivor is an adolescent, age group of 12 to 18. However, emergency treatment needs to be initiated without getting into consent issues or legality to protect the life of the child. So this is the only thing which we have in the POCSO Act right now, but still you all know that consent is not an easy thing. They will come to our clinic or our medical institutes. They will say, we don't want to go for police and all that. And they might even run away. They might even run away from your clinic. So what I suggest is that when you just have that tingling that yes, this is going to be that sexual abuse case, hidden sexual abuse cases in the family, you already have their registered phone number, you already have where they stay. Because when they enter your clinic at the reception, please take down all the details. So then once they run away, after listening that we have to inform the police, they run away, then you have that details, and only thing you have to do is call the police, tell them such and such case happened, and then the rest of the things have to be done by the police. This is important, so that you are not going to be punished, right? That is very important. Next comes medical examination. Now, the POCSO Act Section 27(2) mandates that in case of a female child adolescent victim, the medical examination should be done by a female doctor. However, the law mandates the available medical officer to provide emergency medical care. No, are you understanding? So not everywhere female doctors are available, right? So how to proceed? So it becomes very difficult sometimes. The female doctor is not there. Okay, male doctor is there, but then guardian may not be there who is a female. It may be a male guardian. So POCSO Act is, a little bit of a problem. So the Criminal Law Amendment Act Section 166A of Indian Penal Code mandates the government medical officer on duty to examine the rape victim without fail. This conflicting legal position arises when female doctor is not available. We all know that. We have all gone through this. And now there is another problem because boys are also getting sexual abuse. So now there is a second issue again. So all this thing is still in the gray area of POCSO Act. Then comes the treatment cost. The law has casted legal obligation on the medical fraternity and establishment to provide free medical care to the survivor. But if there are no proper facilities or there is a costly procedure required, then the state is keeping quiet about that. They are not taking responsibility of the cost. Who will take the responsibility of the expensive cost? Suppose a victim comes who has so many tears, who needs a surgical procedure in the first aid and who needs a lot of operations immediately. Then what to do? Because mutilation, all those things are there in rape cases and all these things. Then who is taking care of that? Who will take care of all the costly procedures? The state is quiet about it right now. So this is a very important thing for us doctors, and we have to really raise our issue to the government. Then consented sexual intimacy. I think this gynecologists are all present here must have faced once at least. The sexual contact between two adolescents or between an adolescent and an adult are considered illegal under POCSO Act because no exception has been granted in the Act, under which if sexual encounter the person under 18 is, irrespective whether the consent has been given or not, it is taken as illegal. But we know that our adolescents are very sexually active now, and because they do not know about POCSO Act, so it's there in our society. What to do? That is again, now in the latest amendment of the Indian Penal Act concerning rape laws in 2013, the age of consent for sex has been fixed to 18. Hence, anyone who has consensual sex with a child below 18 years can be charged with rape, which may increase the number of rape cases. So our statistics is going to be boggled. That is very important. One more serious repercussion is that of course, gynecologists and obstetricians, they need to report all the MTPs. This is important for all the gynecologists and obstetricians here. They need to perform all MTPs done on adolescents below 18 years of age. So again, we are in a soup. We have to understand it. We have to again, think about all this. Now, child marriage. That is, of course, we all know that in India it's very common. So even in India, even though Child Marriage Act is prohibited under secular law, it enjoys sanction under certain personal law, thus complicating matters. These issues need to be addressed. So now what has happened is there is a personal law in which it allows for the consensual sex after child marriage. But as per POCSO, it is not allowed. So there is a controversial thing here. Training. Now, as I earlier said, that whenever we have, history we all can take just by the training. But for medical examination, I feel that even medical teachers, even our postgraduates, even pediatricians with experience, even we all need a proper training to examine a rape case or a different type of a victim. So we have to really be trained. So training has to be a very, very important part of POCSO Act. Then role of mental health professionals. So the evaluation, so the definitive signs of genital trauma are seldom seen in cases of child sexual abuse. It is true. So hence evaluation of child sexual abuse requires special skills and techniques in history taking. So forensic interviewing and medical examination has to be taught to all, as I have already said, and this is just a repetition of that. Reporting. It is well known that the cases of child sexual abuse are usually not reported, as Madam also pointed out, that we ourselves are not sure what to do, and that's true. Further, knowing and reporting child sexual offense is highly difficult and highly personal decision for many family members and also for survivors. So not only the doctors, but even the family is concerned about it. So both the survivors and family members, they feel embarrassed and ashamed, bearing the result, the guilt, the anger, the frustration, and emotional turmoil of the act. The fear of re-victimization because of the medical examination, criminal justice system, and poorly informed society members keeps them silent and undergo the torture for long duration. As I said, POCSO Act is a victim-friendly act. And it has to be recorded and all that is there in the definition. But how many of the police people know about it? How many lawyers know about it? And how many doctors know about it? We are not trained yet. We do not have the awareness about this POCSO Act in almost the whole of public, the whole of professionals, and the whole gamut of public doesn't know what this POCSO Act means. So we have to really go for the awareness for this. That is why I felt very happy when Dr. Raj asked me to talk about POCSO. It is very close to my heart, and I feel that everybody, not only the medicos but non-medicos, should also be told about it. So the take-home message here, I would say, is a golden rule to all medical professionals working with children is to report all reasonable degree of suspicion in child sexual abuse to the legal authorities. Hence, professionals need to keep watch on sexual abuse, explore and assess the child thoroughly. Though the POCSO Act 2012 is an excellent piece of legislation, and it recognizes almost every known form of sexual abuse against children, but a few challenges remain. What we need is a multidimensional, multi-agency team and a multi-tier approach, including access to psychosocial support, which will help us, which will help us to declare and to report the cases much better. I think that's the way to go, and we should go forward with more and more knowledge, more and more awareness, and a multi-pronged approach. That's the only solution. Thank you so much for listening to me so patiently, and I hope I brought out the importance of POCSO and also its challenges. Thank you so much.
Dr.
I think it was absolutely a treat listening you. Madam, will you stop sharing? Yes.
Yes, ma'am.
It was really a treat, and I can, before I give it over to all experts who are here, I can see the gynecologists are large in number, and I'm thinking Dr. Jyoti Bhasker and Dr. Achla will see on that particular aspect. We have pediatrician and we have legal luminaries, medical legal luminaries also. There were two questions, and I think each and one of us should know about it. Whether it is an IVF clinic, whether it is an ophthalmology clinic, whether it is any clinic, the examination part has to be done. The onus of responsibility is with them. Even if, as Madam Sonia has said, patient refuses. The moment you come to, you tell them that I will do everything, but I will inform this particular case. The law of land says that I have to inform.
Yes.
They walk away. They walk away, but before at the clinic, the registration is done of their name, their phone number, and things like that. And the same thing you have to hand over. Let the police come. Let the police take your interview. That says so and so a patient had come, and this is what the information I have. So this is what it is. Nobody can refuse an examination. And I will, I think it will come in questions. Everybody, I know about it that as for the rape victims are concerned, in all government facilities, those kits are available. And you will be happy to know that as far as the rape victim examination is concerned, Dr. Gaurav is right here, that we all made, with the help of Ministry of Health and the UNICEF, the film on the rape victim examination. This was made in 2004. Oh, padi rahi, but till the time the Delhi High Court, decided, there is something lying in IMA headquarters, and I think that particular thing should be used, and you will be happy to know now it is used throughout the length and breadth of the country. So as far as the examination part is concerned, in a public sector, they are very clear about it. Nobody can say that we do not know anything about it. Aap gynecology ka karo ya na karo, ye to kaam karna hi padega. So I think, with this particular thing, I will ask our experts to speak one by one. They unmute themselves and speak.
So I'll be inviting the experts.
Dr. Shakuntala introduce our experts.
Yeah, very briefly, I'll be doing that.
Just two lines.
Yeah, we have the luminaries, Dr. Gaurav Agarwal, a medical director and a lawyer. He's currently practicing as medical legal consultant. He's also a professor at Department Forensic Medicine.
Just a minute. Let us show the CV of Dr. Gaurav.
Malti, please show the CV.
Yes, ma'am.
Dr. Gaurav.
We can skip it and save time.
I think that will be much better. Experts, Dr. Gaurav is a medical legal luminaries. He's a professor teaching medical legal issues, and he's a consultant to many of the people who are involved in medical legal cases. Dr. Gaurav.
So at the outset, thank you so much for inviting, and congratulations, Dr. Sonia, for such a beautiful, comprehensive, lucid, crystal clear presentation. At the same time, it gives me pleasure to inform that many of the challenges that were put forth have already been answered by the law of the land. So I'll be happy to take them one by one. First three, I think, have already been answered. So the first one was regarding consent. So the law says it is very clear, if the child refuses, see, uski maa, baap, the parents, neighbor, whoever is brought the child refuses. It is very clear we cannot touch a child. Even if it goes in her favor, his favor as the child, if if we touch the child, then we are liable for battery, which is a legal term, and answerable to law, and we can be charged for an offence. First thing. Second thing, the POCSO Act goes at great length, as you rightly mentioned. It is a very child-friendly act. It goes at great length to ensure that the child gives consent. There are many paragraphs in this. I'm sure we know of it, that we have to cajole by all means possible that it is for your benefit and nothing is going to harm you. So please give consent. If the child is obviously above 12 years, usse niche hai to bachche ki zarurat hi nahi hai, the parents will give consent. So first thing is not grey, it is very clear. Second thing was regarding, could you point that out, regarding the third thing was regarding expenses. Okay, I'll cover that first. Isme do provision hai. The first aid has to be provided free of cost. Okay, fair enough. What if it involves any emergency surgery or any other medical procedure that involves a lot of cost? Isme provision hai, the court can order immediate medical expenses from the government. So you simply, obviously this could be an added expense from the side of the doctor, just to move a plain and simple application to the court for providing medical expenses to the child, the provision for which is already granted in the law. Okay, so we normally assume कि हमारे ऊपर खर्चा डाल दिया सरकार ने. बीच में वो आया था about vitriolage victims of acid. So you have to provide free care, and even if it involves free plastic surgery and all. ठीक है, उसमें नहीं है. But POCSO Act में provision है to provide emergency medical expenses on order of the court. You just have to move an application. Could you point out the second grey part, please, regarding the challenges?
So that was about a medical examination. Jaise, suppose the child is less than 12 years, okay, and he refuses, okay, but parents are ready to get the examination done. Then what do we do?
So first and second I have already taken care of. So the provision is there in the law that you have to cajole, use all possible methods, except of course force, to cajole the child to agree to an examination and consent by the parents of the child, whatever. Otherwise we cannot touch the child.
Yes.
And some other challenges. What was the fourth one, ma'am?
I will on this. I don't remember it offhand. I think a medical examination is
Action by Dr.
Consent, medical
about child marriage, sir.
examination, and
Child
then
marriage.
treatment call. All you have answered.
Okay.
The child marriage.
Child marriage, that is a fallacy in law. But I would like to know which section, where does it mention exactly in the act that child marriage is not, see, it is there, it is accepted by law. There are sections in the IPC, we've been teaching it for a long time, that the government, the country accepts that child marriage is a phenomena.
No, sir. No, sir. Pardon me for telling. Sir, this in the child marriage, if there is a husband is 19-year-old or 20-year-old and the wife is suppose 16-year-old, then there is a problem. Okay. Not only that, because usually they will not marry. Husband will be usually elder to the child, right? So this is one. So POCSO Act does not allow. So the husband will be charged for rape. But there is a personal law which you are saying that child marriage is accepted is by personal law, not by POCSO, sir. That's the problem.
Not by POCSO, but even then courts recognize personal law also as law of the land. So therefore, even if consummation has taken place before 18 years, it will be held valid in the eyes of law. So it is not against POCSO. Yes, that is right.
Sir, but we have had cases in which the husband has been charged of rape, and then because it's a gray area and which law will override it, we don't know.
This is obviously a fallacy in the law. We'll have to wait and watch.
Yes, sir.
I want to put a question to the House. I want to know your opinion. What if in a case the relatives, the fathers, parents say that we do not want any case, our child was not sexually exploited or abused, Therefore, please do not call police, and we do not want any legal proceedings. What are you going to do?
Sir, can I answer first?
Please.
Sir, I have already told during my presentation that in such a case, it is it is very common, sir. I've had so many cases like this. So when they start describing the child, now there is a father who has done the abuse, and it is told very nicely by the mother that father gives bath to the child. So this is a very common practice in South India. Let me tell you that. Father gives bath to the girl child even when she is 10 or 11 years old, sir, imagine. Okay, so this is a very, very subtle way of telling things. Okay, so now as a pediatrician, I know there is something wrong going on, and the history is given that child always, tries to put very hot water on the genitals. Can we understand, sir? Now the mother is here to just take the treatment for the genital burns. Okay, she knows, she is clear, but she knows also that the family honor is involved. So as soon as she tells me, and if I tell her, ye to police ko batana padega, they just disappear, sir. They disappear. So what do? I have noted down their name, all the registration number, address, phone number, in my register at the reception. Okay, so now I have that. Even if they have run away, my responsibility is to call the police or to call 1098 number, that is CWC, and tell them that such and such case, this address, this phone number, I am reporting to you, please take care. That's all. That is my responsibility, ends there. And I am safe.
Very beautiful answer. Actually, it happened with a client of mine. Initially, they had written that we do not want any police action and there is no sexual offense involved. Later on, the doctor obviously in good faith did not, knowing very fully well that there was evidence of sexual offense. Later, they complained against the doctor.
Yes.
So doctor cannot take the plea that they gave in writing that there was no evidence of, there was no cause of sexual offense. It is the doctor's responsibility to report, and therefore the doctor is liable for punishment up to 6 months, as you rightly pointed out.
Absolutely right, sir. Absolutely.
So please, the house should know that even if this give in writing, they can always go back again. हमने bride burning cases में कितना देखा है. पहले complain करते हैं, बाद में या उल्टा होता. So it is a doctor's responsibility to report even if they say they don't want a case.
Absolutely, absolutely.
Dr. Gaurav, मैं एक चीज कहूँगा, this is the common scenario. We run a hospital also. मेडिको लीगल केसेस सुबह शाम आते हैं, जहां उन्हें कहा कि पुलिस इन्फॉर्म करेंगे, अरे नहीं डॉक्टर साहब ये तो कुछ नहीं था, ये तो कुछ नहीं था. इवन देन मैंने ये अपने सब स्टाफ को बोल रखा है, अपने आरएमओस को बोल रखा है. इवन दे रन अवे, जैसे मैडम ने बोला, दे रन अवे, उसको भागने के बाद भी हम पुलिस को इन्फॉर्म करते हैं. एंड इन दिल्ली वी डायल नंबर 100.
यस,
100 नंबर पे सारी कहानी सुना देते हैं कि ऐसे पेशेंट आया था, ऐसे भाग गया, उसने इलाज भी नहीं करवाया. मतलब बता दो, उसने इलाज भी नहीं करवाया. सपोज करो ही सम मिसहैप हैपेंस इन द वे, वो चला गया कहीं और, वो मर गया, फिर कहे कहाँ गए थे, वहां गए थे, तो फिर पुलिस पकड़ेगी आपको. तो इन्फॉर्म द पुलिस कि उसने इलाज भी नहीं करवाया है और वो भाग गए हैं, तो अपना स्किल सेव हो गई.
और सर एक बात और कहूंगी यहाँ पर, डॉक्टर गोयल सर जो कह रहे हैं बिल्कुल सही है. और लास्ट में जब आप पुलिस आपके पास आ जाती है, जब आप उनको डिस्क्राइब कर रहे होते हैं, व्हेन यू आर डिस्क्राइबिंग द होल केस, व्हाट ऑल हैज हैपेंड, प्लीज गेट अ सिग्नेचर फ्रॉम द पुलिस पर्सन whom you have described all this.
Yes.
Please get it written and get it documented that this and this police officer on this and this date and time has been informed, and get his signature or thumb impression there.
एक चीज और कहूंगा, इस इंसिडेंस को, इस पेशेंट को जब वो चला गया है, टू बी रिकॉर्डेड इन योर इमरजेंसी रजिस्टर.
That is also there. Yeah.
दैट इज ए मस्ट कि ऐसे ऐसे पेशेंट आया था और उसको ऐसे चला गया और हमने पुलिस को इन्फॉर्म कराया है, उसका डॉकेट नंबर और पुलिस का नंबर ये है. दैट हैज टू बी रिकॉर्डेड इन अ रिकॉर्ड.
It's a very good moral message, because we might lose one patient, but we are saving our life.
Yes.
So we should,
I think it is our moral responsibility as a society, responsible society member, that we have to prevent these things. Unless we take up a stand on that we will inform the police, even if you don't read. That is how we can stop this. Otherwise, these little girls will keep getting exploited,
Yes,
and nothing would be done, because we want to save our skins. We want to save that. Why should we get involved? So I think it is our moral responsibility to be responsible for these girls.
So lastly,
I would like to present one. Yeah, sorry, sir, please.
I'll just take 2 more.
Yeah, no problem.
Because this thing is very practical from my, whatever experience of having visiting courts to give evidence as an expert witness. Let us assume a case ki we have done best whatever is possible, and the case goes to court. Now we receive a summon, and then we have to depose as a witness, as an expert witness, as a doctor, common witness, expert witness, in both capacity, to testify whatever examination we have done, whatever report we have prepared. So this I'm telling you from, right from horse's mouth, that I have seen many doctors falter during examination process in the court. पहली बात तो इतना डर लगता है कि समन आगे जैसे कि पता नहीं हम ही convict हैं, ठीक है?
Correct.
Now let me relieve you of this stress absolutely within a second. There is nothing to fear from a summon. It is just a plain and simple legal duty that we are performing. Why I'm telling you the reason? Because in the court we just have to make sure of one thing. It is the defense's duty, because he is being paid lakhs of rupees on behalf of his client to save his client. Okay, so they are going to ask you, humiliate you, torture you by questioning is to such a level that sometimes you don't have answers. But the only golden rule to save your skin in the court is to stick to your examination report. They ask you hypothetical questions. If you answer them, that means you have given into their trap. So do not answer hypothetical questions. For every answer for the answer to every question that you have put forth, just try to find the answer in the report itself. If you cannot find it, please do not volunteer information. Because if you are answering from the report itself, then you are very unlikely to make mistakes. You make mistake and you falter and you make a sorry figure only when you answer questions which are not given in your report. So it becomes a kind of Gita for you. कि जो report में लिखा है मैं वही बोलूँगी और कुछ नहीं बोलूँगी. And if you are sticking to that, it is going to save you in all court hearings in your life. Please go ahead.
So I was just trying to say one thing. The figure of 95% of the sexual abuses take care within the families, whether relatives, father, grandfather, grandmother, whatever. It is 95%. So this POCSO Act has been brought for that reason. Even child marriages should be discouraged. That's the reason they have done this POCSO. That's the only reason. So if we are getting trained, if we want to get trained and then, report the cases, I think it will bring down the sexual abuse in our society.
Absolutely.
So there was one question by Dr. Achla. She put up this, that what if victim is reaching the private clinic with a male doctor? What would you say, Dr. Gaurav?
No issues. The doctor, there are two things. First is, let me divide the cases coming to the clinic in two parts, two kinds of cases. One is who are directly saying that I have been sexually abused. So please examine me, please treat me, and let the proceedings go further. For such kind of cases, the law is very clear. You can give the opportunity to the patient to go to a government hospital. You are not refusing, okay? And you can call the police, even and it says that nothing less than a sub-inspector of police will be an IO of the case, and they can take the person to a government hospital. Law is very clear. Even if it is on record that you offered the patient to go to a government hospital and did not treat or examine, it is fair because the law says it very clearly. Okay, and the second part is that you do not know that the patient was sexually abused. So you do a examination, you take history and everything, and then you arrive at a conclusion. For those cases, even if the male doctor is there, then one cannot refuse. It is very clear.
We have other speakers experts with us, Dr. Jyoti Bhasker.
Voice is not clear.
Dr. Bhasker, please make comments, please.
Your comments, Dr. Bhasker.
I think more than comments, being a gynecologist, I think it was a great learning session for all of us. And being in private sector, actually, we really do not come into contact with so much of a sexual assault. So it was a great learning, and I think we need to implement it. But the only thing that I would like to talk as far as the private clinics are concerned over here, we do get young girls between the age of 16 to 18. As you did say, there's a lot of people are now sexually active at that particular age. How do we ascertain from these particular ones that they belong to the age of 16 to 18? Because all of them between 16 to 25, when we look at them, they are nearly about the same age. So do we need at the reception to ensure that they give us an Aadhaar card so that we are very sure what the age that they're registering with us? And if we know it's a consensual between 16 to 18, they've come to us for an MTP as maybe just an early pregnancy. Do we still need to inform the police at that time? And what exactly, how do we need to go about it? So I would like the experts to answer that.
So at least my view is that we take it on patients, we take the patient on face value. If she says she's 17, we'll take it as 17. If she says she's 18 plus, we'll take it on a face value and act accordingly as per law. Even if she's 16 and she says 18 plus, of course, if we find on examination that she's lying or there is a discrepancy between what she's saying and our medical examination, she does not look like 18, but she's proclaiming, but she's less than 18. Then we have the privilege to get a a bone age test done at our own hospital, determine the age, and then act as per law.
Okay.
Can I speak?
Dr.
So here I little bit I differ. So with the rise in sexual abuse cases and with our adolescents becoming very active, I must tell you it's very active sexually now. So I must say that I have made a few changes. I ask for a government ID card when I register. I think that is an easier way out, I feel. Yes, sir is right. Dr. Gaurav is very much right that we take them at face value, but that time is gone. I think we have to change our ways to make ourselves safe. This is my suggestion.
With Aadhaar card days these days, I think Aadhaar card is the thing which we must.
Yes, and they all have it. They all have it.
All have it.
I also agree with Dr. Sonia. Because
but Aadhaar card, hospital use as a registration.
It's very difficult to prove the age.
Yes.
And it is better for our safety, and especially with the POCSO Act. We should have the Aadhaar card as the age.
नहीं आधार नहीं लो आप कोई भी गवर्नमेंट का कोई भी कार्ड ले सकते हो वोटर आईडी कार्ड ले लो डीएल ले लो ड्राइविंग लाइसेंस ले लो कोई भी ले लो नो प्रॉब्लम
वोटर हुआ तो
we should do that also for our clinics also, it means.
Yes.
Madam, COVID की वेव आई है.
refuses Aadhaar card.
Dr. Sanjeevani Khanna.
Yes, ma'am. I have two questions more than points. One is the concept of proximate in age. Like if we have a younger child and we're not sure and there are no papers, then is there something and she doesn't know her age? So is there a concept of proximate in age? Like do we say that she is approximately 10 years, 11 years? We have no proof of age. She's just come from the village somewhere and she's had a sexual assault. So do we just write a query 10 years or do we write proximate in age to 11 years or 10 years? Or is there nothing established?
See, the law.
Dr. Sanjeevani, it happens more often than not. You know it that she looks 13 years and we write down 18 years in our records. I think we should try to ask, our medical luminaries how to save ourselves.
Yes, ma'am. Yes.
So since I am an adolescent specialist also, so I must tell you here that there is something called early adolescence, middle adolescence and late adolescence. And there is an SMR rating we do, that is sexual maturity rating. So if we have a chart of that sexual maturity rating in our clinics, even everybody can have that chart in the clinics. And when you look at the patient, you will get an approximate idea whether this child is in early adolescence or not. So that is from 10 years to 18 years. So you will have a very fair idea. That is from 10 to 18.
That's very useful. Yeah.
So Sonia, you will share that and I will see to it that I share to everybody.
Please.
Yes, ma'am, I will share a photo of that.
Yes.
And the second thing is that many of us have joined late.
No, I have not completed the answer. Wait.
Oh, I'm sorry.
Yeah.
Please.
So this is about 10 and above, okay? But if there is a child below 10, now, that age of 8 to 10 is very mixing. Nowadays, our girls are maturing faster. So again, our adolescence starts at 9 actually, the definition wise, but at 8 also some children develop. So you have to take that into your mind ki 10 se pehle bhi thoda sa sexual, we have to understand that SMR. So there can be a talk on that actually. That will be very good. Now, regarding the child, if it is below 8, then we have to go for the bone, aging. We have to take the X-rays of the wrist and other things, and then ascertain the age.
Yes, I think these points are extremely important, Sonia ji. And the second thing I just wanted to actually clarify was that digital pornography or, superimposition of images on somebody else's body, someone's face. So are these also covered under POCSO?
Yes, ma'am. It is covered.
Okay.
Any photograph, even showing a photograph to a child of a naked person is taken under this law. And even in fact, if you go for a Zoom meeting and all, before the Zoom meeting, when you are going to public, even in DIAP, our pediatric forum, there is a DIAP platform. We are always told that, please, doctor, there should be no photo of any naked child or any naked person in your PPT. This is a law. So please remember, even on social media, on WhatsApp, recently there one breastfeeding specialist expert, she posted a photo of the breast. It was an infected breast. So there was nothing wrong in it, but that is objectionable. And the admin of that group can be taken to law.
Now, here, Dr. Sonia, we'd like to clarify, you're talking of a photo or it could be a diagrammatic representation. Even a diagrammatic representation is not allowed?
No, I'm only talking of the real life photo. So diagrammatic representation, if it is not, वो बोलते हैं ना अश्लील नहीं है, अगर ठीक ठाक है, it is scientific, then it is allowed. Then there is no objection.
Achha, Dr. Sonia, tell me one thing.
Here, Dr. Sonia,
Pardon, sir?
Because we use in our Zoom meetings, academic meetings, we use a lot of naked photos, for example, of patients. The idea here is not about pornography. Idea is
Education.
about education. Yes, medical education. So we can use that as far as the patient's identity is not revealed.
Sir, I don't know, sir. In a Zoom meeting and all, once it has happened with us that some photos were shown of a child with urinary problem and all that, and that Zoom meeting was closed. So there may be some criteria, sir. I can agree with you.
Precautionary approach by the organizer, but as we have to talk about what is the standing law. So as far as
Sir,
the law is concerned,
I think you are a better person in that.
Yeah, we are not revealing the identity. We have to just cover the eyes and face of the patient. That is enough, and we can go ahead with our academic discussions. Not a problem at all.
Doctor, we have Geetendra also with us. Geetendra, are you there?
Ma'am, I think he had left.
I think he has left. Dr. Anita, you wanted to ask anything?
Yeah, we have young girls who are coming to us 12 years, 13 years, 14 years when we want to examine them. So like we write down less than 18, like the patient was examined in the presence of mother. I just wanted to know, is it correct what we are doing?
Absolutely.
Yes, any chaperone is okay. See, usually we will prefer a nurse. Why? Because, mother sometimes, suppose we see some sexual offense thing in the child, and the mother sees it. She may, start becoming very disturbed and, all those things. So first preference should be to a chaperone, like your own person. That means a nurse or somebody of your own, staff. But if they're not there, then mother is fine. Yeah.
Okay. Just an extension of the question.
Here I wish to tell you that we always examine with our junior or somebody. But if you find there's something fishy, you should call the mother right there because she's sitting right there to call them and show.
Yeah. What about father?
Father, हम बुलाते ही नहीं examination के time.
नहीं हम भी नहीं बुलाते doctor. I just wanted to know if the mother is not accompanying the child, then what to do?
No, chaperone.
Any other?
Can I just an extension
Father
of
comes.
this?
But when we examine, I tell them that me and my junior are examining you, sir. Once I have examined, I'm going to brief you.
Okay.
That's it.
So, madam, can I have an extension of the same question? Now, I have a girl who's 16 years old, who's sexually active, and she tells me she's sexually active. She has come to me with vaginal discharge, and which is quite excessive, and I need to examine her. So, since she's sexually active, I think I can put in a speculum and have a look at inside the vagina. So, am I allowed to do it? Do I need to take a consent? Do I need to inform the police that this girl is sexually active? What exactly is my status?
Very, very difficult thing.
No.
Jyoti, I think you have to, under the POCSO Act, you have to inform the police first. Because
Dr. Sonia is an adolescent expert. She will
knowing about that she is sexually active. You have
No,
to.
she has a consensual sexual history. She's not comfortable with it.
Dr. Sonia, please handle
Dr. Sonia, what would your opinion be?
Okay, this is a very, very common scenario because as I told you, our adolescents are becoming too sexually active and this POCSO has come at the wrong time. So what I want to say here is that as I told in my presentation, this is a gray area because our adolescents have no idea, no awareness about POCSO Act. They are doing it as a normal activity. It is what they are learning from abroad and there is no POCSO abroad. Right? So this is a gray area. Even I don't know what he will do in this situation. I myself don't know. Some lawyer has to tell me. I mean, because POCSO doesn't say anything about this.
So, Dr. Sonia, it becomes mandatory that in school education program, we should even talk about POCSO.
Yes, Dr. Aneja, you are absolutely right. Because I myself am now educating all adolescents whom I see. I counsel them. I tell them. I'm doing two things. I'm telling them about POCSO also. I'm telling them about oral contraceptives also. Imagine the controversy.
No, I have got a patient. The mother has got the patient, her daughter. And she knows that she has gone around. She was in Bali, gone around with many people, and she's worried. And she's not 18. Mother knows it, but she wanted you to examine her and you are gone. And you don't know what to do.
In this case, you have to report it. You have to.
I think that's good. It has happened before POCSO. The mother was very offensive. Why you want to make a MLC for my daughter?
Yeah, that they will be. See, all patients, I will say all, they will be offensive against you. But you are a doctor and you will be punished. So what do you want to do? You have to decide.
Absolutely.
Dr. Angela and Dr. Jyoti, in continuation with the important point that you have raised, the school teachers are also in trouble. It's not only the doctors. Yeah. Because the school teacher often discovers first that she sees somebody's phone or whatever. So she discovers and she becomes liable to inform. It's her duty. So not only the doctors.
Absolutely. Equal responsibility for non-medicals also.
So, Dr. Sonia, when you're talking that you tell about contraception to your adolescents, in our country, if there's a POCSO below 18, so are we okay by writing a prescription of an oral contraceptive pill to a 16, or we just need to verbally tell them?
No, we cannot write oral contraceptives for them because if anything goes wrong, you will be held liable by law because you have written a document with oral contraceptive. So please tell it orally. That's fine. That is for protecting the patient.
Dr. Sonia, we can't tell orally because we might be getting recorded.
डॉक्टर कुछ नहीं करना, उसको कुछ नहीं बताना डॉक्टर साहब, आप प्रमोट कर रहे हो ये एक्टिविटीज को। मेरे पास तो अभी ऐसा कोई नहीं आया कि जो 16 साल का वो कहता है कि जी मुझको प्रॉब्लम्स है। मैं आई एम नॉट एट पेशेंट।
आप तो उनको सिर्फ बता रहे हो ना, नॉलेज फॉर 18 years and above also they need OCs ना, तो आप तो बता रहे हो ना, उनको नॉलेज दे रहे हो, सिर्फ एजुकेशन कर रहे हो। अब ये थोड़ी कह रहे हो कि अभी यूज करो।
नहीं, Dr. Sonia, if we are writing a contraceptive pill for a PCOD patient, can't we do that also?
We can do that.
डॉक्टर साहब, जो भी हमारे पीसीओडी के प्रिस्क्रिप्शन हैं, वो कभी भी ओरल कॉन्ट्रासेप्टिव की तरह नहीं बिकते हैं डॉक्टर साहब। They are PCOD pills.
Yes.
That's what I'm saying. If we देखिए डॉक्टर साहब, there are two things: to protect yourself and you have to protect the girl also. we get so many patients who come
We can write for PCO.
PCOD के पिक्चर में लिख सकते हैं, let's not change our focus. A patient who says to Dr. Jyoti Bhasker, she is sexually active, उसका क्या करोगे? मैं कहूँगी भैया Dr. Jyoti Bhasker कर दो.
See, I think as far as the law is concerned, the POCSO Act goes and talks about consensual sexual relationships as well for minors. And as far as the law is concerned, obviously we have to report. There are no two views about it.
So it's a difficult situation.
very scary, very scary.
मैं तो कहती हूँ 18 से ऊपर को मैनेज कर लो डॉक्टर साहब, 18 से नीचे तो फोन पर फोन करना ही पड़ेगा पुलिस को.
उसको pediatrician.
I'm telling you Sanjeevani, except for the public sector. Public sector में एक वहाँ पे एक उन्होंने कहा मेडिकल लीगल का वो रजिस्टर होता है, उसमें ये काम करके MTP करके वहाँ लिख देते हैं पुलिस इन्फॉर्म्ड, वहाँ पर एक स्टैंप लगा देते हैं, बस उनका काम खत्म हो गया. But doctor, otherwise in a private sector things are difficult. I think after this what I have learned is एक किताब बना लो छोटी सी कॉपी, मेडिकल लीगल रिपोर्टिंग जरूर बना लो डॉक्टर साहब.
So, Dr. Poonam Chawla ma'am has raised one question that if you refuse MTP for a 60-year-old lady, she may land up with illegal abortion. What do you have to say on that?
So, see, we cannot refuse. अगर वो आई है आपके पास MTP के लिए, तो the procedure is the same. आप पहले पुलिस को इन्फॉर्म करोगे.
जी.
आप उसको इन्फॉर्म करोगे कि मैं पुलिस के पास जा रही हूँ बस. उसके बाद आप MTP वगैरह करना ही पड़ेगा. You can't refuse.
So the police has
मैडम पुलिस को इन्फॉर्म करके साइमल्टेनियसली काम भी कर लो.
काम भी करना है.
Save the product of conception also and send it to the police. That is
और अगर वो जो 20 वीक से ऊपर वाला चक्कर है ना, वो भी बड़ा वो प्रॉब्लम है. अगर वो 20 वीक से ऊपर हुई तो क्या करोगे? तो then it goes to court.
अच्छा डॉक्टर सोनिया एक बात बता.
Now the new law has come and it allows for
girl
abortion
is
for
18 years.
डॉक्टर साहब गजट नोटिफिकेशन नहीं आया उसका.
अभी 24 right? 24.
नहीं this
गजट नहीं आया अभी.
till now.
देखिए डॉक्टर अगर एक पेशेंट है who is 18 weeks and 2 months and she is pregnant by 5 months. In this case, should we also inform the police?
Yes, yes.
नहीं, अरे अगर वो फर्स्ट मंथ में भी आती है प्रेगनेंसी बिलो 18 years of age.
No, I'm saying she's now 18 weeks plus. Sorry, 18 years plus.
Okay.
And like she's 18 years, 2-3 months, and she's already pregnant by 5 months.
नहीं आप ये बताओ ना, वो भाई सेक्स कब हुआ था उसको देखो. डिपेंड्स ऑन द डेट ऑफ या LMP कब था, उसके हिसाब से आप कैलकुलेट करोगे.
हाँ.
That you have to calculate and see. ऐसे बहुत किस्म हो चुकी है. इवन नंबर ऑफ डेज, एक दिन का भी फर्क हो जाता है, पता है आपको?
हाँ, और अल्ट्रासाउंड में वो 24 वीक्स या 26 निकला है.
तो आपको वो सब एक्सप्लेन करके और फिर करना पड़ेगा.
एक इंसिडेंट.
Dr. Leena, you want to make a comment? Dr. Bishnoi, you want to make any comment? Dr. Leena and Dr. Bishnoi.
My cook daughter got married at age of 16 years. मैंने उसको बहुत समझाया, वो नहीं मानी. I didn't attend the wedding also.
अच्छा क्या?
Like if some police, if our photographs are there, we will also be caught that you were also a party to it.
Oh yes.
आपकी डॉटर कह रहे हो आप?
Dr. Sonia.
No, my cook's daughter.
अच्छा, उसको आप बहुत समझा दो जरा.
डॉक्टर बहुत समझाया, उनको फर्क ही नहीं पड़ता.
एक इंसिडेंट. One of my friend colleague, doctor colleague, gynecologist, she was having a patient who was pregnant, and that is below 18. And it is the unawareness about the act. And then when she was came into the labor, she informed the place where she was working, the owner of that place, and then whatever it is, she delivered. But now she is caught up in the POCSO Act and she is suffering because of this lack of knowledge.
कितने साल की थी?
She was below 18. That girl.
अच्छा मुझे एक बात बताओ डॉक्टर सोनिया, जैसे
इनको कंप्लीट करने दो. एक मिनट. डॉक्टर राज इज सेइंग समथिंग.
She has a delivery.
नहीं तो
मैंने आपको शुरू में कहा था जितने लोग PCPNDT से हैरेस है उससे ज्यादा पॉक्सो में हैरेस हो रहे हैं.
बिल्कुल सही बात. And now she is the sufferer.
No, why she should be the sufferer? She is the victim.
We didn't inform. No, not
The doctor.
Doctor didn't inform.
Doctor. Yeah.
Can we do something the way the PCDNT Act we put it outside? Can we do it in the hospitals also to make it, or our clinics, to make the people, to increase the awareness
Yes.
that they should also understand?
लेकिन अब देखो, you can put a circular saying that any sexual act, POCSO का जैसे मैंने first page आपको दिखाया है ना, उसका screenshot लेके वो लगा दो आप. वो तो आप official information दे रहे हो ना कि any sexual act below the age of 18 years is illegal. Simple language में लिख दो, खत्म.
And it amounts to jail up to lifetime.
Or 18 years means class 12. By that time, 80% are already sexually active.
Yes.
Shakuntala, wind up, please, Shakuntala.
Ji. Dr. Sumani, you have any comments? Leena will wind up.
I think it was too good. Everything, I enjoyed each and every slide of yours.
Dr. Leena, please wind up.
Yes. So, yeah.
Dr.
So
Sonia, you
been
prepare yourself for your SMR classification and
Yes,
you will
ma'am.
send that particular slide. So
Yes,
over
ma'am.
to Dr. Shakuntala.
मैम आपका नंबर मुझे आप दे देंगे, मैं व्हाट्सएप कर दूंगी वो फोटो.
डॉक्टर सोनिया मैं दे दूंगी आपको मैम का
हाँ ठीक है मैम, ठीक है.
So, yeah. Dr. Leena, please wind up. Just Thanksgiving, formal Thanksgiving.
Thanks very much. Days to come, but it set up a very important set of knowledge for all of us that the POCSO Act is very important, and all of us who are have to. This comes to us.
Leena, can't hear you. Leena, can't hear you.
Hello.
Shakuntala, you wind up, please.
So, actually, it was a very, very fruitful, deliberation by you, Dr. Sonia. It was absolutely mandatory for all of us to know, because several of us have been now very well aware of PCP and DT Act. But we could be caught in the POCSO Act was something not known to us. So many facts we got to know. Really, it has been an eye-opener for many of us. And you could see today's gathering, many of us are not aware of the Act and its implications on private practitioners and, the government practitioners alike. Thank you very much for your deliberation. And
Thank you so much. Thank you so much, Dr. Sharda ma'am. I'm so glad I could talk here amongst all the learned faculties and all my seniors and everyone. I would really request you should hold more meetings and, disseminate this more and more. It will be very, very good for everyone. Thank you so much.
Thank you.
And I really thank the experts as well. Thank you very much, everyone. Thank you, Dr. Sharda ma'am.
Thank you, ma'am. Thank you so much.
Everyone for such a good interactive session. Thank you.
Thank you.